This video concerns a pre-operative handover checklist. So as I tried to clarify in the Swiss cheese method session, in my hospital this is performed 3 times to eliminate any errors or mistakes. If you have a look here, there is 29 different questions just on the front. And we'll quickly go through. We can't do all the questions themselves, but the first section here, which is in white, it just concerns whether the health records are available, if there are 2 ID bands with the 3 identifiers, which is full name and date of birth, and medical record number are present, and of course if there are alerts, it should be a red band. If they're on chemotherapy, they should have a purple band around them, and we even have a false risk band. So that's very important. The 3 identifiers being checked, and you can see here we have a list there. If you tick in the white and it was checked and there was no problem, if you ticked in the grey, then it means there's a variance, and that's the first check by the admitting nurse. And then the second column is for the pre-op nurse to tick, and the theatre nurse or anesthetic assistant just confirms that the checks have been done, but there's no extra tick box available. But also very important is to see if there's a consent. Consent needs to be checked, needs to be dated. It only lasts for 365 days. It must be done by a doctor surgeon of the specialty of the procedure being performed, and it must be signed both by the patient and by the doctor. Sometimes we need an interpreter for cultural safety if people don't speak English properly, and at our hospital we have a service that either a interpreter is booked or we can ring an interpreter and communicate through the interpreter with the patient. Then we have a big red section, so here we look at things like allergies. Maybe the patient has a multiple resistant microorganism that we need to alert for, and we need to apply specific precautions. Did they have cytotoxic medications? Pregnancy, and see we have a non-applicable box. For example, if you come for a cesarean section. Diabetes and other alerts, we need to make sure that they're not on anticoagulants. Maybe we need to do an INR, International Normalization Ratio, to see what the blood clotting status is. If they were ordered pre-op meds, were they given? About fasting, when they have last passed urine. Did we put in the early warning tool, basic observations? Did they do the pathology and hematology that they had to do? Was the skin prepped? It goes on and on and on and on and on. Okay, so all of this is important, and no surgery can commence unless this is checked 3 times.